Hey, YouTube audience. Today is the beginning of AEP, and I wanted to bring you a message. I am planning to be live, and if you have questions, you can put them in the comments. But I want to talk to you a little bit about the big Medicare changes in 2025, Part D drug plans revealed, and some of the stuff that's going on. There's a lot of stuff going on, and I wanted to make you aware of it. This year for 2025, this AEP starting today, ending on December 7th, is going to be a year that you really need to examine your plan. And if you want a professional to look at your plan and see, what you have currently and what you may need to go to, I would be glad to do it. There's down below in the comments, I have put my appointment schedule. I needed to put the other thing in there. I'll update that. But anyhow, uh, if you would like to talk to me today, you can call my Medicare number. It's 336-892-8370. Again, that number is 336-892-8370. So, this is the thing that you need to be aware of. There are I just changed to an HMO C-SNP today. Okay, Natty Light King Kong. Let me ask you, where Natty Light King Kong? She must be a beer drinker, or he. Oh my God. HMO C-SNP today. Let me go over some of the changes and let you know. Let me ask Natty Light King Kong a question. Where are you located? What state are you currently in that you had that? Anthem? No, I didn't ask you which plan. I said, which state are you in? What state are you in? Um, but the reason I say this is because the Columbus, Ohio, fantastic. Natty Lights. Okay, the reason I ask you, I wanted to know what state you were in. I was wondering if you might be from Wisconsin. Uh, you are a neighboring state. But anyhow, hey, listen, I'm glad you came in here to go with me live, but I will still address some of the things. Um, each state is completely different. So you're not going and honestly, in the same state with the same company, you can get different plans. He got an HMO C-SNP, which is a chronic special needs policy and or plan. That's how they say it, special needs plan. Um, so he could have a chronic condition like diabetes or a heart problem or uh, Natty Light. Do you have a well, I'm not going to ask him. I'm not going to ask him. But anyhow, um, it can be different things that would allow you to be in that particular plan. Now, HMO plans are a little different than a PPO plan, and that since he says he's got an HMO plan, he is in a Medicare Advantage. Now, the big choice that you diabetes, yeah, he's he's been drinking a little bit too much of the Natty Light. He's got a little bit of belly on him. Um, I, I I wasn't going to ask you because that's not proper for me to ask you. But anyhow, wanted to say this is going to affect every single point of every single plan this year. There's going to be less money for plans like Natty Lights, for the plans. I mean, some of those Part C, those are Medicare Advantage. Part C plans are They have a tremendous amount of different advantages that they have. Like they give you so much for. I mean, they have all kinds of different things. There's a new one. I'm in North Carolina that I have, and I'm, if you're interested and you want to know, then give me a call, 336-892-8370, or you can go to my website, www.michellemorard.com. No space in between, michellemorard.com. Um, but and ask me, because I can help you in different states. But this is the thing is, man, I tell you what, you see my hat here, and I am not, um, I'm not trying to give excuses, but I will tell you this. I am currently going through, he says, I like that the donut hole is going away. Meds have a cap. Yes, and I was going to go over that. I'm going to go over all of that, but that is one of the big changes that we have this year is it has a 2000. Now, one of the things that, the insurance companies have designed away from that is you now have a deductible. Let me look. And and it's not this is where different insurance companies can play with different things and give different advantages for people. That's where I was going. Let me finish this. You see my hat. I am fighting breast cancer right now. And so um, it is difficult for me to retain my train of thought sometimes. So pardon me, pardon me. Um, but you are going to see. I said it's going to affect all three phases. That is your Medicare supplements. You're going to see your Medicare supplements go up. Everything is going up. Uh, there's the Part C, which is the Medicare Advantage plans. They are going to have, they're going to have different. Some of the, and I will just go ahead and say that they will have less of their, you have companies that have been giving, like, I'll give you one example. One example right here in North Carolina, we have a Medicare Advantage company that had $20,000 worth of coverage for dental. And I'm just giving you, and that I'm not pointing out which company it is. I'm just telling you some of the, they'll try to get you with certain things. Another company that I saw that they have is they will give you a pet sitting service. Others will give you food and gas and stuff like that. So there's different companies that will do different things, and that's where you have someone like me, an independent agent, who's able to uh, give you an advantage of, okay, which one is best for you. Now, Natty Light, I am not in Ohio as of right now, but just to give you an example, he said he did it right today. He signed up, and I will ask you this, Natty Light. Did you go to an agent, or did you already have an agent, or did you go through Medicare or some other way? Did you go straight to whichever company? Well, you said Anthem, Blue Cross, Blue Shield. So did you go to their website? Did you go to an agent? Did you go to Medicare.gov? If you don't mind, I'm getting Anthem agent is how he got that person. Okay. Now I will tell you this, just to give you an example, and I'm not in Ohio, so the Anthem agent is safe because who wouldn't love me as their agent, right? I'm, I'm joking. I'm joking. Um, this is the deal. He signed up today with the other Anthem agent, and he decided that, he wanted to look at a different plan. He has up until December the 7th that he could make unlimited changes. So don't think that just because you signed up today that you cannot make changes. You can make changes. That's what the AEP is all about, is to allow you the opportunity to have all kinds. And he's talking about he has $70 OTC quarterly. So he's going to get $70 quarterly, and they give him a list of different things that he can get. Like they all have their special things in there, like uh, vitamins. They'll give you first aid stuff. They'll give you different. I mean, they give you different things. They give you different options that retirees like. It is as far as that's concerned. He got that. And $150 utility quarterly. Okay, that is interesting. He lives in Ohio, so you can see how they tailor these plans to go after certain individuals. He's going to get a little bit extra to go with that particular plan and get some money to go because his utility bill's probably gone up, right? And that's the. I mean, they have that. Uh, just to let you know, they have a plan here that is a Medicare Advantage plan. I'm not going to tell you the company, but if you want to know, give me a call because I'm right here in North Carolina, so I can absolutely help you. But anyhow, let me say this. I think it's like, I don't know, they have, maybe it's a montage of different things because I think it's like, and see, I don't know what the current thing, I think that was last year. It was $350 for different things like, and I've got you can use it towards rent. You can use it towards different things. Those are type, food, rent, whatever that they will allow you to use it for. So it's interesting to see how it can help you do what you need to do. But let's go over the things. The supplement plans, if you have a supplement and a Part D plan, both of those premiums will be going up, guaranteed. And if yours is not, it's probably because you haven't got to your birthday yet. I'm noticing that Medicare is big business, many YouTube videos. Well, it's not just that, Natty Light. It's not just big business. This is the thing is, there are 10,000 baby boomers turning 65 every day, and maybe even more than that. And that is why people need help. And I've been in this business since 1997, just to give you and I've been doing Medicare that long, and seen a lot of changes throughout the time. And before that, my mom, oh, he's on disability. I guess he's a he. I don't know. Um, and like he said, there's people out there that are on disability as well. So it's not just people that are turning 65 and above. Okay, he's. I figured Natty Light. I didn't know of a woman that would be called Natty Light King Kong. I wasn't sure, but I didn't think so. And I was calling you he, and I get that's a stereotype, isn't it? We shouldn't be that way, but a lot of times we are. But I love it. I love your nickname, Natty Light King Kong. I love it. I absolutely love it. So anyhow, thanks for letting me know so I can address you properly. Um, so anyhow, I've been in this business a long time. It's not just I will say this. There's a lot of people that have a lot of different businesses that are going on YouTube and letting people know, because they're just letting people know it's one of the best ways. YouTube is a great outlet to share with people how what they do. And I plan to be doing a trying to go live every day on throughout the AEP. God willing. God willing, even on my days that I'm going to have chemo, and I've got 3 more chemos to do through here. They'll be spaced out, but I'll either do a short or a live video and let you, maybe I'll let you go with me to do the chemo treatment. The only thing is I always typically, typically it's not as bad as it was before, but I really do usually get a little bit tired in the middle of it and I fall asleep. So it depends. And some days, honestly, with the cancer, and this is why I'm doing this live video. I will say this to you is because you know, some of the rules. That's why I'm telling you what my Medicare number is. You reach out to me, I can help you. Um, they're making it stricter and stricter. Do they make change to hospital scan procedure? They make changes every year to all different. I'll put his question up here. They make changes every year to all of those things. That's why you have to compare, and that's one of the reasons why it's so confusing and why it is such a hard thing. With a Medicare supplement, I will say this: you don't have to worry about all the whatever. You just know that when you have a supplement, it automatically changes to whatever the changes are with Medicare because Medicare changes every single year. Look at my hand. Look at my hand. But anyhow, uh, the I told you I get distracted, guys. Let's go over it. He already mentioned the $2,000 prescription annual out of pocket cost max. That's the max that your drugs will have. And they also put a let me see. I got to read now. Well, of course, that means that if it's 2000, they eliminated the donut hole. So you're not going to have to, but what you will have is at the beginning, the typical deductible is $590 deductible for most drug plans. Now, that's what I'm saying. Not every single plan has the deductible apply to every single tier of drugs. There's the preferred generics and usually generics, and then you get into brand name drugs and then preferred name brand drugs, name brand, non preferred brand name drugs, and specialty drugs. So typically, they break it down like that. Some break it down. I mean, there was another one that was last year that had 6 different tiers, and typically, all of his drugs are covered on no copays. And I've got a company. I have a company right now. This is how companies distinguish and they're willing to try to go after different business is I have a drug plan that is a less expensive drug plan right here in North Carolina, um, that they do not have any deductible on any of their drugs. So that may be attractive to people. So, and if you want to know what that particular company is, you need to call me 336-892-8370, or you can go to my website, request information at www.michellemorar.com. But anyhow, so we've gone over, I was going to say in the Part C, which is what he has, what Natty Light King Kong has, he has a Part C, which is a Medicare Advantage. Copays are possibly more, deductibles are more, everything's going up, and you may have reductions in things like eyewear, glasses, dental, part of the dental that they have for drug these Medicare Advantage plans. They will cut, like he had the let's see, $70 on the over the counter stuff, the OTC, the over the counter stuff. They may reduce that. I had a client that I was talking to last night. She said, "Well, my OTC has gone down." And I said, "Well, I know." And uh, the other thing is they have gone, what I have personally seen right here in North Carolina, and I'm in other states, Alabama, Texas, and Virginia. So if you're in any of those states, I can help you there as well. But anyhow, right here in North Carolina, is reducing these things. He heard that the Inflation Reduction Act is part of what is causing some of these uh, things, and uh, Joe Biden's inflation is causing some of these things to go up as well. Let's be fair. Oh, oh man. And everything's going up. Part C's going up. All the copays going up. Well, this is what I was getting like the maximum out of pocket. That's one thing that you need to be aware of, because some of these are going. I mean, used to be, you know, I've got the it used to be they were $3 to $5,000, and if it's an HMO, probably around 3 to 5,000. You can still get some of those plans here in North Carolina, but this is the deal: is a lot of these other companies that have had a hard time with different things that they're addressing some of the other plans. There's plans that are pulling plans that they had. Like I told you, in North Carolina, one company may have 10 or 15 different plans. So, just to, like, he's got the HMO CSNP, and, they have different HMO plans. They have plans that give you your Part B premium back, but on those plans that are giving you your Part B premium back, they also put it on the back end where it is you have a larger maximum out of pocket, so that if you have a huge health problem, you get put into um, you go to the hospital several times, and you go to skilled nursing care, and you max it out and stuff. You may start hitting those, especially if you're not in network. So, that's the thing, is he's got an HMO, which dictates to him that he can only go to in network hospitals and doctors. If he goes out of network, then he has to pay for everything himself. So that's the difference in HMO and PPO. PPO will allow you to go out of network, but it also has a higher cap on the maximum out of pocket. Um, I know I know, I'm glad your doctors are in network, but I'm just telling you, if you have something specialty happen to you, that's the drawback of the Medicare Advantage plans. I'm just telling you, I will let you make your own decision. Uh, I'm not I sell both. I sell both Medicare supplements and Medicare Advantage. Of course, I sell Part D too, because you have to have a Part D if you have a Medicare supplement. But anyhow, let's see, we've covered. Okay, Part D premiums are going up. Their deductibles are going up, and I guarantee you, you need to make sure, just like he did. I'm hoping that his Anthem agent went through all of his drugs, all of his doctors that he has, and that they're all in network, and that they're covered. I'm glad he says he refers to it. You just need to make sure. I'm just telling you, a lot of times with an HMO, you also have to get it. Even with the PPOs, you have to get pre-authorization and stuff like that. But if you're going to have a major event. Whereas when you have Medicare supplements, I'm just giving you the difference, and I let people decide on their own. Um, it's to me, I'm not going to be paying your bills like you're not going to be paying my bills. So you have to make decisions for you, and I have to make decisions for me. And I'm going to tell you, everybody is different. Everybody. Your doctors are different. Your drugs are different. So you need, I have a lot of people. Oh, I've got to have the same thing my husband has. Well, you don't. You and your husband are not the same. I mean, I'm just saying, you want to get the best plan for you, and he wants to get the best plan for him, or I'll give it to you, but you got to make sure your doctors and drugs are in the plan. That's my deal. Um, I'm glad that your doctor refers to your people in network. I'm just telling people, because I'm not just talking to Natty Light, even though I have enjoyed Natty Light King Kong being on here. I really, really have. You've made it more engaging, and I'm so happy that you came on here. Um, Everything's going up. Prices in different areas. I'm trying to explain to you that, the Part D premiums are going up, the supplemental plans premium is going up, and the Part C, some of the Part C plans are going to have, um, they're going to have some premiums. One of the most attractive things that most people love about the Part C premiums is they have the no additional premium other than what you're already paying for Part B. So, and then some of those plans, I did tell you, some of those plans have the zero plan, plus they give you your Social Security Part B premium back. But now, listen, if you're already in a situation where you are not paying a Part B premium because your income is too low, then those type of plans are not good for you because your Part B as in boy. So I want to make sure Part B as in boy, which is your Medicare Part B as in boy, is paid on the Medicare Part B as in boy. So, those plans, they do have those. And I mean, see, look, we got Medicare original, we got Medicare supplements to help you not have to pay anything else. Because, if you had cancer like I do, and you had a let's say $100,000 bill because you're going through chemo and it's expensive and whatever, the total bill is 100,000, you would have a 20%. So that would be $20,000 bill that you would be responsible for. So that's why people get a Medicare supplement. I'm just telling you. Then the Medicare Part C, which is the Medicare Advantage plan, which is what Natty like King Kong has, his $100,000 bill, it may be that same 20,000 that you would base it on, but he has a cap of maybe $5,000. So the insurance company would cover the rest of it. So you would pay up to the $5,000, and then the insurance company would pay the difference. That's just to give you an idea. Okay. Your plan may be different. I'm just giving you an example. And these are all examples. And that's what I'm saying. And then the Part D has nothing to do with anything medical. It's all about drugs. And guess what? Chemotherapy is covered under Part B, as in boy. so, so, you know, you got to know certain things. And that's why it's good to have an independent agent that has different companies, that they can compare different companies' plans, and they can give you choices and let you decide on what you want to be responsible for. So we've talked about all the premiums are going up. We've talked about the $2,000 is the maximum that you are going to be paying on prescription drugs in either a Medicare Advantage plan or a Part D plan. So that's the maximum, and you can set up. Let me the elimination of the donut hole. So what they used to have was the deductible, your copays that went up to a certain amount, and then you go into the donut hole where you're responsible for everything, and then you go into another amount of money that you're paying, and it's like 5%, goes down to 5% that you have maximum for what your drugs are. The $590 deductible for the drug plan, and then they also have for this year, you can set it up for that $2,000 to be a payment plan so that you do not have to pay it all at one time. You can set it up, and it will be over the whole year that you would. So you're looking at, if you set it up, 2,000 divided by 12, so you would have a maximum of 166.67 is the maximum that you would have to pay in any one month. So that's good for people that are getting most of their money on a monthly basis. Now, I have no idea what would happen. Well, no. So that's how it is set up. I'm not going to put anything else in there. The Part D premiums have been capped at 6%. So that's why some some plans that you have this year, some of your drug plans, the agent is not going to get, they're not going to get paid on. So, in other words, if you have one of those plans, then you may not have help from your agent because they're not going to be paid to help you. I'm just giving you a little heads up, even though, they're capped at 6%, but because there's going to be less and less, drug plans available, because you either have huge, I mean, why in the world would you get a drug? I mean, I just can't imagine why you would get a very expensive drug plan, because you already have a cap of $2,000 that you're going to have. So, and I mean, some of these plans are, I'm telling you, some are going to have a majority of them are going to use that 590 deductible for the drug plans. They're going to use all of that, and they're going to have that, and they're going to increase their premium to the max of 6%. And then, like I said, there's going to be less frills on your Medicare Advantage plans. So those are some of the basic things that are happening right now. And wanted to let you know, this is the time to look at your plans from today until December the 7th. Like I said, if you did get into a plan, you can make a change still, because you can make unlimited changes right now up until December the 7th. But it is good to have a independent agent that will give you the options, all the options that you have, and let you make the decision, because you are responsible. You're ultimately the one that is responsible for which plan that you pick. And I will say that, and I will get off of here. Natty like King Kong. I really, okay, let's see. He said, well, he said, is Part D inside a Part C? Of course it is. Well, let me say this. There are Medicare Advantage plans that do not have a drug plan included in it. So not all. That's a beautiful home, Michelle. I'm sorry, my husband is aggravating me. Is Part D. You don't necessarily have drug plans inside of every Part C. There are Medicare Advantage plans designed specifically for veterans so that they can use the veteran system. So not everyone does it, but if you look at your, let's see if I've got one. Let me see. This is, well, I don't want to do them because I don't like them. This, let me get me. I don't mind supporting them and telling you that I have these people. This inside yours, can you see that? Well, anyhow, this is a booklet. I don't know. Summary of benefits. You will have a summary of benefits booklet that the agent will give you. And you will go in here and it will actually say whether the plan has, and usually it's toward the back. I can't see. It will be toward the back, and it'll have prescription drug benefits in this particular plan. I don't know how to get this. Anyhow, trust me, it won't show the white. Interesting. But anyhow, they will do these. They will have it included in your booklet. So you need to go to your booklet and look towards the back. That's why you need to make sure that your plan has it. And then he says, I'm in a higher copay for a med in 2024. I'm waiting until to order a refill on a med. Yeah, those are going to be changes too, that they will make changes. I'll be honest with you. Humana was one of the Um, you know, that was one of their big calling cards. I'm just giving you an example. But they had, I don't know, you've seen the guy on television and he goes over the the plan on television and he talks about he said, I can tell it's a green screen. I know Natty Light, and that's why my husband, John, or Timmy, um, is aggravating me. I like this I like this gr- uh, uh, background. I like it, so I like to use it. Um, anyhow, okay, where was I at? See, you got me distracted. Okay, here we go. I'm in a higher copay. So, of course, they're going to make their drugs higher. And like I said, Humana, that was one of their big calling cards. They had, we help most Americans, seniors save on their drug plans. And we've saved them so much in a year's time. We've saved them so much because they had a lot of zero that they didn't pay anything for any of their drugs, and so and those were generics. I mean, they were generic. So, it just depends on your particular situation, and especially with Natty like King Kong, if he were to be on some of those more expensive diabetic um, drugs, then that may be something that he needs to look at, and they may try to put you on something that is a brand name sometime for whatever reason. But anyhow, I wanted to. There's Timmy. Timmy's funny. Uh, I just wanted to let you know. I'm going to keep it in the I think it's already in the description that if you need, if you want to book an appointment or if you want to give me a call, you can go to you can call me at 336-892-8370. I'm in North Carolina, Virginia, Texas, and Alabama. Man, wouldn't that be a great football game? Texas and Alabama. I cannot wait for Texas and Alabama, Texas and Georgia. Big, huge fan of SEC football, but I'm actually a Clemson fan. Clemson's my team, but I enjoy watching great football. The only reason I'm talking about that is because I am in Texas and Alabama, and honestly, that is going to be. I don't know when they will play or if they will play because I'm pretty sure they are, but I'm not sure because Alabama and Georgia played, and I guess Georgia put it to the Alabama Crimson Tide. uh, he's got, yeah. Maddie Light, really, honestly, I really appreciate your interaction. It really does make it better when you have somebody that is going to interact with you and let you know different things. Like I said, if you want to reach out to me, um, you can give me a call. You can go to my website, www.michellemorar.com. That's my name right there, Michelle Morar. It's my husband's fault that it's Morar. Difficult to say. It's difficult to say for me. But anyhow, um, I just wanted to go over some of the changes because there are changes and people need to, a lot of times people just, you get deaf to I mean, everybody's talking about, oh, it's AAP, go and do this, go and do this. But I am telling you, go and do this year. You need to review your plans. That is imperative. If you don't do it with me, do it, you can do it different places. You can do it with different agents. You can go to Medicare.gov. You can do it. You can go to, if you have a company that you like, you can go to their plan and you can look it up. Those are things that you need to do to make sure that you know some of those changes. Now, the company that you're currently with, will um, they will send you the changes, and it's important to read those changes. Don't just throw it in the trash like you do on some of the other. This is an important year because there are major, major changes. I hope. Hope that I'm signed up. Oh, I know you're signed up. If your dude came out and signed you up, he signed you up, or if he did it the way ever, you can do it. Let me say that you can do it multiple ways. And me being with cancer, I am going to go see a few of my clients in person, and I might personally go and see you. But if you're here in North Carolina, I'm not trying to. I'm not probably not going to go to Virginia unless you're in Danville or I don't know Martinsville might go. I mean, just depends. But um, uh, I'm just saying, Martinsville, Virginia. Uh, you know, if you can sign up lots of different ways. I can send you a link and let you sign up, put your information in, and you will be signed up. And that's how I can do it remotely. But no doubt, well, I can't promise that other people are not going to. Oh, he signed up online. The agent didn't show up. Oh, okay. Well, do you know your. So, did your agent send you the link? Because if you signed up differently, I don't know what's going to happen, man. I'm not sure. You might want to reach out to your agent and see. Um, I don't know. I don't know how if you went straight to Anthem's website and signed up, then you're signed up probably. Yes, I got an email. Okay, he sent you an email, and it was a link in the email. And I hope he did look up your drugs. I mean, you know what? I would definitely. I'm going to give you some advice. I would definitely go to Medicare.gov and I would look up and make sure your drugs are in there. I would also um, probably go to the website and make sure that your doctor. I mean, if you had the same doctor and you had is if this is a new plan, because I will tell you this, I'm going to give you a little secret here. You want to make sure that if you got a new plan, you want to make sure that the doctor that you had last year that was accepting Anthem Blue Cross and it wasn't a C-SNP, uh, that they accept that particular plan because with the C-SNPs, with the plans, they can have different copays. Like, I mean, there's a lot of plans like this particular plan here with this particular company that I have that's right here in front of me. They have a 0 for your primary care doctor and any of the specialists. So you want to make sure that your doctors and all your drugs are in the plan, because if they sent that to you, I mean, if you put it in, if he knows, if he knows all your drugs, if he knows all your doctors, and you gave him that information and he put it in, I would feel okay. But if you either need to make sure or you need to see about whatever. So I'm not in Ohio, so can't help you there right now. But I would encourage you and let you know that unless he's actually went through and looked at your drugs and looked at your doctors, you need to make sure for particular plans, because I can I'm just telling you that happens with the same company in the same state. That means that Anthem may have 6 different plans. Um, and they have PPO plans, they have HMO plans, they have C-SNPs, they have people that are on Medicaid and Medicare. So you have to make sure that you know I do reviews with people. So if you are in the situation like Natty Light King Kong, and you're in North Carolina, Virginia, Texas, or Alabama, I'll be glad to help you. I've got limited amounts of time that I can help people, so I need to stick to the states that I'm in. And I may expand to Ohio sometime, Natty Light. then I could be your agent if you wanted me to. Um, but I'm just saying, you really need to make sure because that is something that happens to people. But let me go back to this and say, yes, you can be emailed the link to sign up for the new plan. And if he went over the benefits, I mean, he's supposed to go over the benefits with you. I mean, that's part of the thing. He, she, her, whatever. Um, you're supposed to go over the benefits with the individual and make sure that the doctors and the drugs are in the plan. But some people send out the email links and they sign up and they, you know, that's that's part of an agent's job is to let you know and to get it. If they have already talked to you, they've already sent you the summary of benefits. Um, but you may get it through an email, so you need to go into that email and look for your summary of benefits because the company will automatically send that to you, and it's going to come through your email. It's not going to come in book form. They're trying to cut down on waste of agents asking for too many of the, and they print this stuff up, they print it up, and that's a cost to the insurance companies. So they're trying to reduce that for sure. So anyhow, let's see here. I take, oh, Jardiance is covered, but I'm sure that Jardiance is probably, because that's probably an expensive drug, you're probably going to be subject to the deductible, whatever the deductible is for that particular plan. I don't know, but and then you'll pay the deductible, and then the copay and whatever, and that I don't know what tier it would be, but I can guarantee it's a generic because Jardiance is a brand name. So I talked to a person on the phone and they told me all meds are covered. Okay, well, I'm assuming so you talked to your personal agent that you were talking about. I mean, and that's fine. I mean, I've emailed people, they haven't emailed me back. You people out there that I have emailed, email me back. I'm killing myself today. Oh Lord. Uh he signed up online, the agent didn't show up. He got an email. He talked to a person on the phone. I'm just telling you that, just make sure. Um, just try because you can make unlimited changes, okay? Um, I you know, this is what I was that I was going to say to you, Natty like King Kong. You can go to Medicare.gov and you can look and see. You can put in your zip code. You can put in your drugs. They don't do doctors, and you put your and you can say, okay, I want Medicare Advantage, the Part C, or you can look up the Part D plan. Um, he's trying to contact his agent. Well, like I said, if you are an agent I don't know why an agent wouldn't be answering their phone on AEP. Really don't. Um, they may be out of the business. That happens in insurance all the time. That's why I'm doing this, and that is why I am doing this. You said it must be big business. Well, I'm just telling you some of the changes that will take place this year and that you need to look at it. And like I said, if you're in North Carolina, reach out to me. If you're in Virginia, reach out to me. You're in Texas. I love you, Texas and Alabama. Reach out to me. Um, I will be glad to go through, and I'll go as fast or as slow as you want me to. That sounds bad, doesn't it? But I mean, I seriously will. I will take as much time with you that I need to, and I'm trying. I'll be honest with you. Um, as long as you're intelligent enough to be on the internet, I can help you. Okay. If you're older and you need help, then you probably, if you're, it doesn't matter if you're older because my mom is 80. Let's see, one from for is she's 83, and she's very she's on the internet. She's done different things and been whatever. So I will say it depends if you are. And I've got another client. She's 75 and she's very internet savvy. I may have to take a little bit more patience, but I can help her because um, she's able to do it. But if you are an older person and if you're watching this video, you're probably internet savvy. Okay, that's why the guy sent you the email. You signed up. You're happy. I'm just making sure. My mom is 78 and can do internet thinks, thinks. Things. Okay, gotcha. I know, that's what I'm saying. It's not necessary. And then there's other people that are not, they're 65 and they're not as savvy on the internet. That's not what they did. And that person would, need to stick to somebody that's local, the local agent. They can sign you up on the phone, but I'm just telling you right now. Uh, if they're signing you up on the phone, you can run into trouble if you're not talking to the individual. And I mean, honestly, you still have to do certain things. So I'm not sure. But my whole point is this: if you need some help, reach out to a local agent. I told you where I'm available and be glad to help you. Other than that, I really, honestly, Natty like King Kong, man. I do have to go see some clients tomorrow. I'm not sure what time I'm going to do the live stream. Maybe same time tomorrow. I'm not sure. It depends. It all depends. Look, guys, I am battling cancer, and some days I feel better than others. I'm just telling you. But thank God I can sit here and do this. I hear my husband coming in with the dog, so I'm going to have to get off of here because we got to get some things done. But I really appreciate everybody coming in here, at least watching the video. If you do have comments, post them below, and I'll get back to you and answer any questions. But I will say this: unless you talk to somebody personally, you can run amok. I will just say that. His mom just lost a boyfriend that was battling cancer. So that's why I'm saying I'm doing more things on doing the internet stuff as far as that's concerned. I'm doing more, and I would do the email. I would send them a link. But honestly, I will get on a Zoom call with you. And when you're talking to somebody with a Zoom call, you're going to see what they're seeing, and you're going to be able to share and do. So that's what I'm telling you. I'm willing to. My nose is itching. I'm willing to talk to you and willing to help you in any way if you are a senior in any of the 4 states that I just mentioned. I was in Oregon, but I cut them off. I was like, not going to do them. Anyhow, thank you for coming and spending time. Make any comments. Thank you, Natty like King Kong. I love your nickname. I love it. Thank you so much, and I will talk to you soon.